Right, this. Okay, so this week we have a very lovely guest speaker, and her name is Nino. And so after that, after the guest speaker event, we're going to be going over a case study involving Phineas Gage. I'm sure you've heard of his name. And then we'll be doing a presentation about liver resection, which is a type of surgical procedure. And then we have some interview tips, which you guys really wanted to do. So yeah, can we please have Nino for the guest speaker event?
Hello everyone. Thank you for the warm introduction. I'm really happy to be here. Thank you to Aspiring Synergist Network for inviting me to have this webinar today. And yeah, let's have some fun. First of all, I know how busy all of you are, so I'm really happy to see you gathered here, future doctors, researchers, or maybe innovators. Our topic for today will be doctoring progress, how to manage, grow, and excel, even though medical school can feel a little bit too much sometimes. Because I guess it's not just from one or first anatomy lesson to the graduation, it's not that straight line. There will be some challenges, some roadblocks, but I'll try my best to share my experience, how I handle it, through not just with the textbooks, but with the experiences I had throughout the world, I guess. And meanwhile, if you have any questions, you can, I guess, ask in the chat or after my presentation, you can definitely raise your hands and I'll be more than happy to assist you however I can. Okay, slide. First of all, a little bit about me. My name is Nino. I am from Georgia, but not the state, the country one. I have graduated medical school this year, July 2025. I have graduated from David Pildiani Medical University, which is also located in Georgia. I have successfully passed USMLE Step 1 2 years ago in early December 2023. And I have an international research experience mostly in cancer biology, immunotherapy, and a little bit of the AI pathology. I was in China, UK, US, and in Germany as well. I have done some researches in Georgia too, mostly in oncology departments. Currently, I work as an invited lecturer at Georgian universities. I try to teach first year, second year students some things about the basic medical sciences and a little bit of research methodologies as well too, because I'm not sure, but it's not really part of the current curriculum in Georgia. So I try to teach them about the systematic reviews, meta-analysis, case reports, and such. And I'm also a statistics analyst person in a boot camp, which is US-based company. It's mostly about the BIA, data science, AIs, but I analyze the data and I have the curriculum team to apply data-driven approaches to the education. Okay, next one. Great. So first of all, you made it. You are in a medical school. I guess part of the 20 or 25% of the journey is already over. But now how to handle the reality of the medical school. When we think about it, I guess the first thing that pops up in mind is maybe saving lives, having a purpose in life, a white coat, a stethoscope. But the reality, the one we don't really talk about, is that medicine can also feel very heavy, sometimes lonely as well, and I guess endlessly demanding. On average, a medical student studies 60 to 80 hours a week, which is a nearly double time for the full-time job. By graduation, we have memorized more than 25,000 of medical terms, and it feels like you're learning this new language. But the difference is that someday you might save someone's life with those facts. Every lecture brings a new information, every exam can feel like a final judgment, and every mistake sometimes feels deeply personal. A 2023 JAMA Network open meta-analysis revealed that 1 in 3 medical students experience depression or depressive symptoms, and 1 in 4 report burnout before they actually get into the clinical years when we do the clinical rotations. Even more alarming is that suicidal thoughts are nearly twice as common among medical students as in the general population. But these are not just the numbers, right? Sometimes these people can be your friends, your roommate, your love partner, your classmate, or maybe even you. Medicine teaches us to be or have to show empathy to our patients, but sometimes forgets to teach us empathy toward ourselves as well. A 2022 BMC medical education study found that more than 70% of medical students say constant comparison with peers is their biggest source of stress. We enter medical school as a collaborators, yet slowly begin to see each other as a competition. We measure our worth by have scores, someone scored higher, or maybe published first, or maybe presented more at the conferences, forgetting that we are all working towards the same goal to heal and to help. And I guess 2025's Nobel Prize in Physiology or Medicine was also a great example for that. Because there were 3 scientists, right? And one was working in Japan, 2 were working in the US, and if they hadn't shared their knowledge regarding the reg T cells, maybe they would not have gone to the understanding now they have that Tregs actually orchestrate the immune tolerance. So I guess competition is great as long as it's healthy because it keeps you on edge. But sharing is, I guess, one of the biggest parts, like a networking in this kind of environment. And when we do struggle, when we do have the challenges, when we reach out that point of the burnout, we don't really ask for help because, for example, less than 40% of students even know where to access mental health support at their institutions, or sometimes universities doesn't really have it. And I guess that's another concern. But if your university is not providing something, for example, a club or a meeting or the organization, you're never limited to create one on your own. For example, I was always very interested in the oncology part, the like researches, breakthroughs they have in that department. But we didn't really have one, like a club or the organization in our university. So I created one. We didn't really have a lot of members at first, but as the years went by, it evolved. We actually got in contact then with the different platforms. And today, after I graduated, someone else became the president. So seeing that something I started is still involving in the university is another success story for me, I guess. And throughout the whole journey, I guess sometimes it's really easy to fade what got us there. And under these endless PowerPoint presentations or sleepless nights. So one of the first recommendations I could give you is to keep that sparkle, that memory, that core memory that actually got you into the medical school. It can't be as superficial as just a title, just a salary, just expectations, but something personally inspiring you to be in this field every other day. Because as much as it's amazing to save someone's life, there will be some challenges that might make it hard for you to stay grounded and stay in the field. Medicine trains your brain, but it also tests your heart. It asks you to stay compassionate when you're exhausted, to stay focused when you are overwhelmed, and to stay resilient when you're uncertain. So if you're struggling, remember this, you're not failing, you're just maybe transforming. Medical school doesn't just make you a doctor, it changes who you really are. It stretches your mind, your patience, and maybe your humanity as well. And now that you have faced the realities of the medical school, maybe that's the way how you are becoming the doctor you had in your mind. So now that we know that there are some struggles, let's see what can we do to make it better. If there are some techniques we can follow to not just survive, but to truly flourish. So there are some tips we can follow to manage academics like a real pro. The first thing I've learned is to learn smarter, not harder. Tools like Anki, for example, if you like flashcards, if you like to create your own flashcards, you can do that. There are thousands of flashcards you can actually access. Download it, have it in your phone, and if you're on the way, on the bus, on the train, you can always do those cards. I guess Q banks are also very, very essential because it's a one thing to understand the topic, but it's another thing to understand, okay, how are they going to ask me something about it? So Q banks sharpen those new skills or those new informations you are requiring and helps you to present your knowledge in a better way. If we think about them like they are your memory gym, so you're training that neurons. Using active recall and spaced repetition, I guess, are also very, very essential, and just passively rereading something again and again. Because as we see, to just reread something is not as effective. It's in the red zone. So better be to practice it more and maybe doing that flashcards or you're just reading through your notes, the summaries of some key facts you learned throughout the lesson or the lecture, I guess. And studies show that this can improve long-term repetition by up to 300%, which is a huge number, I guess. When you quiz yourself repeatedly, your memory strengthens, almost like a exercise for your neurons. The second key is to master focus and the flow. The brain can only concentrate for so long. So I use what I call the Pomodoro Plus, which is 50 minutes focus time for the study and maybe 10 minutes to rest, with the longest break after 3 cycles. I also practice interleaved learning, mixing subjects instead of studying them in isolation. For example, I would alternate between pathology, physiology, and the pharmacology. So, first of all, understanding what's normal is the physiology, then go to the pathology, okay, what went wrong? And then pharma, okay, how can I fix this? And sometimes, if I wanted to challenge myself even more before I even learned some things about the drug classes, when I read through the disease, I was asking myself, okay, how can I fix this on my own? If I could invent any type of drug or maybe approach, what would I do to solve this issue? And when I had my own theories or my own hypotheses, then I would go and read about the pharmacology. And it made it easier for me to train and also to understand, okay, how these drugs really are working. Science shows that interleaving increases problem solving and retention by 25 to 40%, which is, I guess, keeping your mind active and to also prevent the burnout. Finally, you have to make a knowledge stick. This means using multimodal learning, watching videos, drawing diagrams, listening to lectures, teaching yourself or the peers. One of the good examples is, I guess, blurbing learning, if you have heard about it. It's when you're reading something and you're just reading it out loud. For life sciences, it was shown that it's one of the great, great techniques to go through the lesson or to read the chapter and then maintain and make them from the long-term memory into the short one into the long-term memory. And I guess one of the most important parts is also to sleep. I know that it's a funny thing that when you're learning about the importance of sleep, when it's at 3 a.m., but they are very essential, especially before the exams, because I know that's the time when we are all anxious, when we're nervous, we feel the judgment day is here. But that sleep really, really helps you to strengthen new synapses, literally turning short-term knowledge into the long-term understanding. So if you take just one thing from this slide, remember that success in medical school is not measured by how much you study, but maybe how strategically you learn, focus, and consolidate your knowledge. The next slide, please. Okay, so we went through some techniques. So how can we actually use them for exams? For example, USMLE Step 1, which is an international exam. And if you're not aware of this, USMLE stands for United States Medical License Exam. They are 3 in total, and they are essential for you to pass if you want to do a residency in the US. So it's a one thing when you're preparing for the exams that you actually take in your university, maybe the quizzes that were written by the professor or the tutor you are attending the lectures of, but it's another thing to prepare something that is international, something that might be out of scope at the moment. So you have to see, okay, which books should I use? Because maybe the ones I'm using in my university are not qualifying me to be prepared for this exam. So that's why there are different books and different approaches you can follow. And because I have taken USMLE, I thought I could share my experiences more about this exam specifically. First of all, decide why you are doing this exam. I know that medical school exams are essential for the graduation, but USMLE or PLAB slash UKMLA EMCs, they are not essential for you to be a doctor, right? No one will tell you, oh, you haven't passed USMLE, so you're not considered a doctor. It's an optional thing to do. So first of all, find the why. Want to do residency in the US? Yeah, you have to take it. Maybe you just want to add it in your CV. Well, that's fine too, as long as you want to test yourself, I guess. But for me, it was a little bit different because I never wanted to do a residency in the US. But I was confused third year medical student, and I saw that all of my peers were taking this exam. And I asked myself, if so many smart people decide to do that, maybe I should do it too. Maybe it can help me to find what I can do after I graduate from the medical school. And I did that. And it was not that strong grounding rule for me. I was struggling to keep up and to do and prepare for the exam because I didn't have like a main idea or the goal why I was doing it. So save yourself sometimes, and before you choose to tackle something as challenging as some kind of international exam, make sure to know why you're doing that, and how it can help with your career. Then choose your materials wisely. What I mean here is that USMLE has this specific curriculum, for example, that it follows, and you can actually find that on their official webpage. And every other exam has them outlined, sometimes in blueprints or something, on their official web pages. USMLE also has this first aid book you can actually follow. But my recommendation would be that if you're planning to take your USMLE, do not study from the first aid. First aid is your summary. It's the book that just summarizes the key concepts you must know about the topic. You actually have to come here and just maybe refresh your mind, maybe say, oh, okay, those are important parts. But if you are learning something for the first time, do not use that book to learn. Use it to recall, let's say, or to fresh your mind, or maybe to add some notes here and there. Um, as for the other materials, there if you go to any other forum, there are some groups on Facebook. There is a huge platform on Reddit. You can definitely check those as well. And there are so many students sharing their experiences. Sometimes someone can tell you that this is the gold standard method, which is going with the first aid, doing UWorld, or maybe watching the B&B videos, or you have to see Pathoma videos. But I would suggest to find something that works for you the most. For example, I started with the UWorld. UWorld is like a huge Q-bank designated for the USMLE exams. Step one, step two, step three, it has the all. And I did start with it, with the UWorld. Is there any question? Oh, I think. Okay, I can continue. So yeah, what I was mentioning is about the U world. It's a gold standard, and every other person you ask, they are preparing for your assembly with the U world Q bank. But I went through with it for I guess 30 to 30% when I realized that it was not really working for me. The percentage I started with has improved with the numbers, I guess. But I didn't really like maybe the format, maybe how they were asking the questions, maybe the feedback they were providing. So I started to explore the other Q banks, and then I discovered the Amboss Q bank. And the questions were similar, The lengths were the similar. But what I loved about the emboss was for each and every question, they were providing why you were wrong, what was true parts, like a correct version to answer. And they would also insert an article you could have maybe read before or read now to understand the topic even more. So that's what I loved about it the most. And compared to the U World, for me, when you were answering the question, then they would give you the huge article digesting every other answer in that article. But sometimes they were so big that I would forget what was the topic about, the question about, why I made a mistake. So with the emboss, I think I made a job decision because when I was saying that, yeah, preparing this emboss, my peers were really asking why your world is so good. I know, I'm not saying it's not. I'm just saying that for me, Amboss worked better. For me, for example, Pathoma worked better than the BNB. So I used, I guess, a few months to study or choose the method or the study materials I would use, and then I stuck around with them. It's a good thing to ask, of course, for the experience, most of all, someone has been using to get the high scores, but at the end of the day, choose something that will work for you. Don't overload, choose a few of them and follow that. No problem to explore new options, but if you see that something is working for you and you're scoring better and better, use that one. No matter if it's not a gold standard, as someone has mentioned before. Active practice is the key. What I mean here is that I know it might be a little bit harder, but when you're preparing for this international exam, in your mind, have an average date when you might take the exam. For example, I started preparing for the US Assembly when it was May 2023. So I knew that, okay, by the end of the year, I want to be done with this exam. Because when you're international medical graduate, we don't have these specific times from our medical school that yeah now you can prepare for the assembly so you don't have to do your medical school exams or the lectures. You have to balance both of them. You have to prepare for the exam plus attend the lectures, so it's a time consuming, it's going to be challenging. So if you take more than a year or maybe two to do that, you will burn out. So try to maybe condense it into 8, 9 months. So that much you can struggle, maybe have a challenge. But at the end you will be done with it. So then you can uh be like, okay, I passed the assembly. Now I can take rest before I do the next one. And with that, consistency comes in a big hand. So every other day doing the tasks, maybe a block or the two, and each and every block has like a 40 questions. But if you feel that in 40 questions there were a lot of things you didn't understand, you don't have to do more than you can take. But doing them every other day is one of the key factors that will help you to retain the information. You can also make a plan. For me, it was to first of all go through the basics and then summarize things with the first aid, then do the key bank and NBME assessments were the later ones. So NBMEs are these official tests actually written by the US Assembly people, the ones who also create the official exam. So with an NBMEs, you can actually see, okay, where I am, how good am I answering the questions. And one of the rules I set for myself is that if I score more than 70% in NBMEs for like 4 or 5 times, I know that I'm ready to go. So you can definitely do that as well. NBMEs and free 120 of your mirrors to see if you're ready for the exam or not. And the concepts that are in NBMEs are the ones that are very frequently also asked during the US Assembly main exam. I saw 5 or 6 questions that resembled some of the other questions I did during my preparation when I did the NBMEs. As for the mental and physical preparation, such kinds of international exams not just test your knowledge, but also your test taking skills. Because I've seen some of my peers who didn't failed who failed step one, not because they didn't know the topic or didn't prepare, but because they struggled with the anxiety, how to balance that anxiety. Or maybe while they were preparing, they were not testing themselves with the timing too, because such kind of exams, they also have the time. So, for example, for a question, you are given 1 minute and 30 seconds for the assembly. There are some other exams when you're given 1 minute, maybe 2 minutes, but it's always time constraint. So you don't have a whole day to sit there and answer the questions. As early as you start with the time constraints, like when you maybe have a timer and you're seeing how long it takes you to answer the questions, might also help you when the day comes. You have to do that at the end before you go to the exam, but starting it earlier, well, it will not hurt. And as for the anxiety part, maybe you can also find different things that calms you down. For example, for me, it was during the breaks, I would listen Eminem songs. I don't know why I've never been that huge fan of the rap, but it was just motivating me. So you can take the breaks between the blocks or whenever you feel like it, but you have to finish the block and then take the break. So when I took 3 breaks, I guess, and I had these songs ready, so I was just listening it, calming my nerves down, and going back to the room to finish the next blocks. So understanding that will also definitely help you to stay calm and see that it's just an exam. No matter the outcome, it never determines who you are or what kind of doctor you will be. It's just an exam and nothing else at the moment. And our post-exam reflection for me was to maybe see actually where I was going with it. And I think taking this exam actually helped me to later really understand what I wanted to do after I finished medical school. I loved medicine and I love medicine and love the sciences, but I never really liked how I was practicing it in the clinical settings. So I decided to stick with the basic medical sciences and to follow the research more than the physician pathway. Um, the next slide, please. So that's when I actually, after the assembly, is when I actually started to do and maybe pay a little bit more attention to the research part because, well, during the first 2 years of the medical school, I was mostly trying to understand the topics and get the knowledge and everything. Third year was mostly about the assembly. And when I was done with it, I actually asked myself, do I really want to be a doctor, like a physician? Or maybe I want to do something different to practice it or discover something and then it will be used in the medicine. So one of the first things I did after the U assembly was actually do the research internship because there was an opening here in Georgia. So I tried myself, okay, let's see how the lab work goes. And after a few months, I really loved what I was doing there because I was testing the knowledge, I was getting this hands-on experience, and what I was doing was actually changing the outcome of the patients or how they were treated. After that, I did multiple researches throughout the world because I wanted to see the different settings, how they were doing it, for example, in Asia. That's why I was in China. Then I wanted to see the European part. I did one in Germany. I was in the US too to see how they were managing the protocols there. I also tried one in the UK. And I got all of this hands-on experiences and really understood that this is actually what I'm really good at, that I actually want to follow. Yeah, but while you're the medical student and you actually want to be a physician, do I have to do the researches? Because yeah, I'm interested, it's good. As I see, well, it's a higher exposure. It's a good thing to have in the CV. But should I do that? Should I maybe dedicate more time to it other than doing something else? Well, no. If you really want to be a physician, there are other things you can do, which are electives, for example. Electives are when you do these clinic rotations, maybe in your country, maybe outside the country. So you are experiencing this clinical settings in the different countries. So you can actually choose if you want to do residency in yours or maybe somewhere else. I guess researchers are very important if you want to do, let's say, a surgery residency in the US because they really also pay attention to that part. But if you prefer to do more of the research, I guess internships are your go-to. It also helps you to do the networking because, for example, when I was doing one of the presentations during the conference, I actually met this doctor who was also head of the AI department in the Kansas Medical University Center. And after the brief conversation, we exchanged the ideas, and he actually invited me, if you like, you can join our research. And that's how I got into the position and did one in the US as well. So if you have an opportunity, see pros and cons there. If it helps your career to be this person who is very great candidate, will help you with to get the position to be a different among the others, do it. But if you just another line on the CV and you don't really feel that motivated doing that, then I think you can definitely find something that is even better compared to doing something just for a line in the CV. Um, can we go to the next slide? So if you are interested in doing these internships, there are different techniques you can follow. So where to actually find these opportunities, because if you just finished the medical school and you have an amazing grades, well, it doesn't really make you a different, right? Because if I'm choosing a candidate for a position, I need to something to see in your CV, let's say, that makes you stand out. And such kind of experiences like a research, maybe publications, maybe even doing these electives, volunteer work, organizing a conference, presenting during the conferences are the ones that make you different. That yeah, I went to medical school, but I also managed to do this. So one of the things you can do to find such kind of opportunities is first of all with the university resources. Because sometimes universities are affiliated or in connection with different universities. So they can actually help you to get a position, or maybe they know a doctor who is conducting the research or needs a help with the systemic review, and you can join the group. So first of all, start with your own university. If there is not something like that, then you can always go to the university's web pages all around the world. And in the career segments, they always have, if they're searching for someone for the volunteer work, if it's an internship, if it's maybe a course you can join in. So always checking the official web pages is the better because there are lots of scammers too. So make sure that if you're filling the application, if you're sending your document, that portal is real, solid. Yeah, and it's an official one. Networking and connections, you can definitely ask your doctors, professors, alumni, peers. You can reach out to people via LinkedIn or maybe find them with the search button if they are in the same field, if they've done some researches or internships. And if they did, you can message them. How did they find it? How did they get there? If they have any tips for you, because before you join some facility, let's say, it's a good idea to check the people who graduated from that. You can ask, is this a good group of people? I mean, what will I gain from that place? Did you like being there? Was the investigator good to work with? Because like it or not, if you're doing a research, your senior, the investigator, for example, might be a turning point because how good the research goes is very much dependent on them. Online platforms like LinkedIn is a good choice. ResearchGate. You can also use cold emails. Cold emails are when you just find the professor, see their work, you're very much interested in what they are doing, you want to be part of the group, so you can directly message them, email, for example. And while you're doing that and writing down the cold emails, also make sure that you briefly summarize their recent work so you are aware what they're doing. You read the paper, for example, the last time they published it. And just briefly also add, how would you contribute? Do you have some ideas that might help them? Do you have some questions maybe they can take into account? Because you also should show them that you are interested, but you also have some skills that might help their projects. In structured programs and fellowships, there are thousands of web pages where you can find them. You can just one of the ones I think I used was Opportunities Corner. That's the name of the web page. And you can just go there and find the internships and the researches, some courses. And the good thing about it is that they have it like a list, and they have the official web pages linked there as well. So if you apply there, you're actually going to the official web page and you're applying from there. So you know that it's not a scammer web page or something. And yeah, you're not limited to reach out to people. The worst thing that can happen is that they might say no. And don't give up with that. Sometimes they say no because they need some extra fundings to accept external students. Sometimes, or most of the times, they don't reply to you because they are very busy. But it doesn't really mean that you have to give up, because if you really want to do something and be there among the greats, do everything in your power to be one of the people who are pushing the boundaries. The next slide, please. So, doctor you're becoming. Um, you are more than your exams. So, first of all, no matter if it's the score you wanted or if it's not the score you wanted, they do not determine what kind of doctor you will be. They are just one of the exams. They are just challenges that you might face. They will never determine the potential you have as a doctor. Consistency over perfection, even if it's a small study sessions, even if it's an hour or two, it's always better than not doing anything and then doing everything in one day. Because yeah, you might pass that exam, pass that oral exam, but a few days later, that knowledge you got in one day will definitely, well, get lost. Therefore, always make sure that you're consistent, that every other day you're doing something, even for if you're too tired, maybe just 30 minutes or an hour. Seek growth opportunities. Don't just be okay with your comfort zone. Try to come out of it. Try to see something new. Try to reach out to some people. Try to see their points of views or why they did something they've done, because maybe it's not making sense for someone else, but it has to make sense for you. And if you have that, just go and explore. Prioritize your well-being. Mental health, sleep, and balance are very essential for the long-term success, because as we mentioned, there will be some challenges and there will be some hard days. And at the end of the day, yourself is the all you have. So make sure that you're also taking care of yourself as well. Reflect and celebrate the progress. When you achieve something, celebrate it. Make a day off. Do something good for yourself, because it's not an obligation or a list you have to follow. It's something that you learn from your setbacks and you finally got there. So celebrate it as much as you can. And your journey is a unique one. Focus on your path. Competition is okay, but maybe the best way is to compare your current self to the older version and how much you have grown throughout the journey. Um, okay, that's all. If you have any questions, I'm more than welcome to answer them. You can actually type in the chats too if you don't want to raise a hand or something.
Thank you, Nino. If anyone has some questions, I'm sure Nino can wait for a couple more minutes before leaving. Thank you so much, Nino. This was actually really helpful, even for me. I'm not even in medical school, but it was really, really helpful. And when I get into medical school, I will definitely be using these tips. So thank you so much. And yeah, thank you for being here.
Thank you for having me.
I
It was
think we
lovely.
have a question.
Okay. Out of your experiences in research, which was your favorite or most insightful? Very interesting question. I think the one I was super interested in was the one I did in the USA. It was I actually took part in creating an AI that was we were giving us the data of like a histopathology or cytopathology pictures uh, before the treatment and after the treatment, and it was actually giving us an idea, like a prediction if the how would the treatment would work in a different case scenarios. I have never done coding before that, so that's why it was a little bit of a challenge. But because I had this opportunity and I had to step out of my comfort zone, before I got there, I had like a 2, 3 months to prepare. So I actually got to the coding. I learned on my own Python. I learned on my own the PyTorch, which is the program you use for Python to be used for the machine learning and the AI. And when I got there, I was not a professional, but they were very understanding and so happy that I actually studied on my own and I knew the basic parts. So if you have such kind of opportunity that seems very amazing for you, but maybe you don't have enough skills at the moment, but you have time, prepare for it. Even if you do just the basics, they will see that, yeah, this person is actually interested. This person actually wants to do it. So, yeah, we made a good decision that we invited her here. And after that experience, I was so inspired by this AI life sciences. I actually decided to go to that field. And currently I am doing the research in that field at the moment and plan to follow that road. So I guess that was the most insightful and the favorite one I did out of my experiences.
That's actually really interesting. Yeah.
Thank you for the question.
All right. We'll be moving on to so yes. Oh wait, more questions.
Thank you. Yeah.
Oh, okay. All right. Thank you so much, Nino.
Hmm?
Now we're gonna move over to Phineas Gage, which is the case study we'll be going over this week. And I'm sure you've heard of his name because he's a really famous neurological case, and he essentially pioneered neuroscience and neurology and the research that went into it. So, before we start, let's do a brief introduction on who Phineas Gage was. So, he was an American man and he was born in July 9th, 1823. And he died May 21st, 1860, when he was aged 36, so quite young. And he died in San Francisco. And for his job, he was a railroad construction foreman for Rutland and Burlington Railroad. And he was described as a really efficient, capable, and well-balanced and shrewd individual before the accident. And as I mentioned before, his case provided the first scientific evidence linking brain damage to personality changes, and he revolutionized the understanding of the frontal lobe's function, essentially. So the day of the accident, which was September 13th, 1848, and he was aged 25, he was working on a railroad construction near Cavendish, which is in Vermont. And he was setting explosive charges to clear rock for railroad tracks. And so this process involved drilling holes in the ground and then filling them with explosive powder and then using like a tamping iron to pack the powder down. And so while he was tamping it down, the explosive powder, panting down the explosive powder, a spark ignited, and this caused an explosion. And this propelled the tamping iron through his skull at a high velocity. And the iron rod entered below his left cheekbone and exited through the top of his skull. But amazingly, he remained conscious and actually rode on an ox cart to receive medical attention. So this showed that he was able to walk and speak, which is amazing if you think about the horror image that comes. Uh, so yeah, so initial medical treatment was provided within an hour by Dr. Edward Williams. And later, Dr. John Martin Harlow was became his primary physician. So Dr. Edward offered initial treatment where he cleaned and dressed the wound. He removed the bone fragments from the wound site and he applied cold water dressings. But unfortunately, there were complications that arose. So the wound became infected, and Gage developed a severe fungal infection in the exposed brain tissue and he became semi-comatose for over 2 weeks, and it's essentially in the name, semi-coma. So he was partly in a coma, like he wasn't completely in a coma. And he suffered from fever and delirium, and delirium is acute confusional state where he was essentially not in the right cognition, which I can imagine if if you have a tamping iron, um, an injury like his. Um, and so this required surgical removal of the infected brain tissue. Okay, treatment methods in 1848 that were available are calomel, which was a mercury-based compound, and it was thought of as a miracle drug and it was used for almost everything. And its first documented use was in ancient Persia in the year 1850. And essentially, because it was a mercury-based compound, it did cause mercury poisoning in patients. Um, Castoreum, which is also known as beaver oil, was believed to have healing properties, and Roman women inhaled fumes of castoreum as they believed it would induce abortions, and obviously this wasn't true. Um, and it was also used to reduce a fever, and how they did that was they used the powdered form of castoreum and mixed it in wine, and then they drank it. And it did work because it contained salicylic acid, which, if you know, is the main ingredient for aspirin, which is a painkiller. Bloodletting, it's been around since the medieval times, and so it was a standard practice at that time, and it involved the four humors. And then so the timeline of healing essentially. So September 13th was when the accident occurred. Then late September, the Gage developed severe infection and the semi-comatose state. But then in October time, his condition begins to improve, and November time, his physical wounds were healing. And then next year, January 1849, his physical recovery was complete, but unfortunately, he lost vision in the left eye and had a large scar and depression in his skull. So personality changes. So his primary physician, Dr. Harlow's famous description from the research paper he wrote in 1868 was the equilibrium or balance, so to speak, between his intellectual faculties and animal propensities, um, which basically means he tends to behave like an animal sometimes, which is a crude way to describe a person, but that's how he perceived his personality changes, seem to have been destroyed. So essentially, Gage, before the accident, was described as a very efficient, capable, enthusiastic, respectful, and considerate uh, person. But then after the accident, he was quite capricious in decision making, meaning that he was quite indecisive. He had troubles with decision making. He was quite aggressive to some people, it's been reported. He became really impatient and unable to follow through plans, and friends actually said that he was no longer Gage. Um, so, from a neurological perspective, the area that was destroyed was the ventromedial prefrontal cortex, and so that is part of the frontal lobe. And it is obviously a crucial area involved in decision making, emotional regulation, and social cognition. So, this part being damaged showed clear signs and outcomes in Gage's personality changes. And so this accident essentially revolutionized neurology because prior to Gage's case, the frontal lobes and the brain altogether was considered quite silent, like it was just there and it didn't have a clear function. And the brain was viewed as more of a uniform organ instead of like certain regions being responsible for certain functions. And his case would provided first evidence that specific brain regions control personality and social behavior. And so his case is essentially the foundation for understanding traumatic brain injury. And it also provided informed research on executive function disorders, and it contributed to the development of a surgical process known as frontal lobotomy, which was rightly so discontinued because essentially what it consisted of was severing, damaging like neural connections between the prefrontal cortex and the other parts of the brain, such as the thalamus. And obviously, that's not a really good idea because that's causing irreversible damage and it could potentially lead to brain damage. It will lead to brain damage. And frontal lobotomies were used to treat disorders such as really, really severe cases of depression, bipolar disorder, or schizophrenia. And his case influenced neuropsychology and cognitive neuroscience and continues to do so. So his life after the accident, so in after his physical recovery in 1849, that 1 year between 1849 and 1850, he attempted various occupations but didn't seem to stick in one. And it's been disputed among like historians in that in 1850 at Barnum's Museum, he actually displayed himself alongside the tamping iron, but this is disputed and it's not like confirmed. Then in 1852, so 2 years after that, he moved to Chile and he worked as a long distance stagecoach driver. And then 7 years after that, he returned to the USA to live with his family as his health began to deteriorate because he was developing really, really extreme seizures. So just a year after that, he attained status epilepticus, which is a prolonged seizure above 5 minutes. So it lasted more than 5 minutes, and he got that on May 20th. And then the next day, he actually died because of the seizures, and they were related to the brain injury he had when he was 25. So then, 7 years after his death, his body was exhumed and preserved, and now it's displayed at the Harvard Medical School's Anatomical Museum. So modern research was caused because of Gage's case. And so in 1994, there were CT scans of Gage's skull by Hannah and Antonio Damasio, where they reconstructed the exact path of the tamping iron. And it was essentially then where it was confirmed damage to the ventromedial prefrontal cortex, which just signified how important that region was for personality and social cognition. Functional MRIs, essentially, MRI, the patient lies down and the magnetic resonance imaging happens. Functional MRIs are where the patient can move and the physician or medic can ask the patient to do certain activities to show activation of certain areas of the brain. So essentially, a functional MRI showed frontal lobe activation during decision making. Then PET scans, also known as positron emission tomography, revealed that the frontal lobe was really involved in personalities of individuals. And then Gage's case also suggested brain adaptation and neuroplasticity, and this formed the basis of basically modern rehabilitation for patients that suffered traumatic brain injuries, because it showed that there's a hope for recovery. So lessons from this case, there's scientific lessons such as specific brain regions have specific functions. Frontal lobes are essential for personality and social behavior, and that brain injury can cause profound psychological changes, and that the brain does have some capacity for recovery and adaptation, which is neuroplasticity. There are also medical lessons that you can learn from Gage's case, which is importance of careful documentation. So, Dr. Harlow, how he wrote the two research papers, he wrote two research papers to document Gage's recovery and also his actual injury. And also, uh, his case shows a need for comprehensive assessment, not just physical, but also the like psychological changes a patient can have from a certain disease or certain injury, and understanding that survival itself is not the same as full recovery. Because yes, Gage survived the tamping iron accidents, but he didn't fully recover at that point. So treatment is important to actually recover and have a sustainable quality of life to call it full recovery. And so here are some references for further reading. So some research papers that I used to make this PowerPoint. Okay. Can I have Soma for liver resection, please? Thank you.
Everyone, my name is Salma and I'm the education officer. And today for the surgery, I'm going to be talking about a liver resection. Next slide, please. Thank you. So just for a little context, I'm going to be talking about the liver itself as an organ. So the liver is in our upper abdomen and it lies under our rib cage. And the liver is a really important organ because it has multiple functions, some of which include producing bile, which is really important in digestion as it helps with the emulsification of lipids. Another function of the liver is that it also produces enzymes, which again are really important in digestion. And arguably, one of the most important functions of the liver is detoxification of the blood. And I've got a little.
I think we're having a couple issues. Um, I'll just continue the presentation until Selma can. So the liver is responsible for detoxification.
Uh,
Can
can I have
you,
the next slide, please?
yeah. Okay, so liver resection
Yeah,
is are you here?
sorry.
Okay.
Sorry about that, my internet disconnected. So what is liver resection? Liver resection is a surgical procedure which is used to remove a part of the liver. And this can be done through more than one way. It can either be done with an open surgery or a keyhole surgery, which I'll talk about later in the presentation. And the reason why this procedure is done is usually to extract a tumor. It can either be benign or malignant tumors. However, it's important that surgeons leave enough of the organ for it to function properly. And it's really interesting actually with the removal of up to two-thirds of the liver, and usually it goes back within 3 months of the operation. Next slide, please. So more about the surgical procedure itself. As I said before, it can either be performed through an open surgery or a laparoscopic surgery. So with laparoscopic surgery, the robotic surgeries are less invasive because they're done through smaller incisions, and that usually is around 4 to 6 incisions, each about half inch in size. And these smaller incisions make it easier and quicker for recovery post-surgery. Um, However, on the other hand, traditional open surgery can also be used if necessary. This is for more extreme cases or for larger tumors, and it can manage more complicated liver resections. So in this process, one long incision is made, and this is called the laparotomy, and it opens up your abdominal cavity. And surgeons use this technique to visualize your abdomen directly. And as I've already mentioned, it's best suited for more complex procedures. Next slide, please. And so I just thought I'd put a little diagram of the different types of resection that can happen. And these are the most common types of resection surgeries that can be done. So with liver resection, the surgery is named based on what part of the liver is removed. So for example, you have your right hepatic lobectomy, and then as you can see, some of the right side of the liver has been removed, and then so on and so forth with the others. Next slide, please. So this surgery has both benefits and complications as any other surgery will. So some of the benefits are that it does completely remove the cancer compared to non-surgical methods, which only delay development. Of course, this does come with the risk that the tumor may come back. Another benefit is that it can also improve long-term survival from 25% to 45%. This surgery does have some complications though. So, for example, jaundice, which is yellowing in the eyes after surgery, and this might happen due to excess bile, as sometimes the remaining bit of your liver might struggle to cope with the bile. And another complication that might happen post-surgery is a bile leak. And again, this links with the fact that the rest of your liver might not be able to cope, so bile might leak from the incision of the liver. And further operations may be needed if this does happen. So there are alternative treatments. This isn't the only option that's available. So, can you give an example? There's also a treatment called microwave ablation, which is basically heat from microwave energy, and then this is used to destroy cancer cells. There's also another method which is called selective internal radiation therapy, and this is generally used with tumors that cannot be surgically removed, and it involves injecting microspheres of radioactive material into the arteries. And I'd say the main benefit of these methods is that they're less invasive compared to the surgery. I think this is the last slide, so thank you for listening, everyone.
Thank you so much, Salma. Can I have Silver, please?
Okay, hi. We're going to be going through interview prep in this segment. So next slide. So a little about me. My name is Silva, and I did get 4 out of 4 interview offers, which is why I'm going through the interview section. And I also did some other healthcare degree interviews as well, and did get my offers for those. So basically, a lot of interview prep has been done. So we're going to go through some miscellaneous things you can do to prep. I think some really good ideas that can help you start getting ahead with your prep is definitely prepping with friends and family, because they know you best and they know how you usually speak, which means they'll be able to tell you if you're doing anything a bit too much or a bit weird when you're doing interview prep. And you can make sure you sound as if you're actually prepping with someone that you've known for a long time. It can be a great way to get yourself and the interviewer in a really good mood for your interview. And that can be a way that you can really just increase your chances, because communication is usually something that's very readily scored within all your interviews. Next, some other things you can do is like joining Discord servers or group chats. Some people don't really like this idea, but I think it was the best thing I did for interview prep, just because it meant you got to work with a different range of people, and you also got to learn a lot of different answers to different questions. I remember I was speaking to someone a couple of last year, and we had different approaches to how you answered the questions, but it's because we're all unique. So you can actually learn how other people from different circumstances would answer questions and use that to actually aid your answer because you get a different perspective. One other thing is actually searching for modules on the university websites. Like for me, I had applied to Exeter last year, so I learned about they had a module which was called Healthcare as an Ocean, which was a really weird module, but it was something that was really unique to Exeter. So I had that when it came to interviews, and I was able to talk about that and how that's unique to Exeter and how that's something I wish to learn about. So looking at really specific modules. And also, as much as people say don't learn questions off by heart, there are some questions which are obviously going to come up. So obviously try and learn those questions beforehand. But okay, next slide. So we have a lot of different types of questions and ways you can answer them. So some common questions that usually do come about are breaking bad news, explain the outcome, helping an actor complete a task. These can be some really good role play stations. You also have your basic questions like why medicine, how have you shown this skill, have you demonstrated this skill? Other questions like how have you shown teamwork, everything like that. Now, timings for MMI stations can usually be between 5 to 10 minutes. If you're doing a panel interview, it can actually range from like 20 to 30 minutes. But obviously, even if you do finish a question early, if it's a panel interview or even an MMI, they usually have follow-up questions they can ask you, or they'll give you more time to just like think of anything else you could add. Or there's some weird stations where you actually just have to sit in silence until it ends, but you're going to get used to that. I actually had the opposite problem. I kept going over the time. So they'll literally just cut you off and move to the next question. And it's not really something to be offended by. It's more like if you don't go through all of the questions, you're not going to get marked for all of the questions. So try and stay within the time limit. So one other thing is you definitely need to focus on making the interaction as natural as possible and making it positive. If you come across really negatively or you're not smiling, you're not happy, the interviewer is going to see that. And you also have to remember these are people who could be working with you throughout your whole career. A lot of interviewers can be doctors, medical students, and they can also be patients. I know some universities had some really weird stations where they were actually solely looking at how you were acting as a way they marked you. So some really good strategies to cope with this. I remember I was in a group chat, they also put this inside. It's definitely empathy, having active listening, being really sensitive and having good communication skills, making eye contact with the interviewer, having a really loud, clear voice. But yeah, these are some good strategies you can start using. So what are some key things you can start talking about? I haven't put all of the NHS values here, but some really good things you can talk about are NHS values. For example, here we have compassion, improving lives and everyone counts. These can be really good things to just mention. For example, you're answering a question and you actually bring up the fact that I was also saw that this actually links really well with the NHS's core values. And that way they can see you've done some extra reading alongside answering your interview questions. But let's move on to the next slide. Okay, then we have the 4 pillars of medical ethics. So autonomy, the right or condition of self-government, so the patient's free to make their own choices regarding their own healthcare. So actually linking all of these really in. Some interviews actually ask you to compare different pillars, asking you to compare autonomy to justice and which one's more important. So actually knowing the pillars of medical ethics can be really good. Same thing for dentistry. Knowing these pillars can be really nice just to help you when you're answering questions. Let's skip through the pillar slides then. So another pillar, beneficent, which is doing good and acting in your patient's best interests. Another pillar is non-maleficent, so doing no harm and actively trying to help others. And the last pillar is justice, so that's the quality of being fair and reasonable. And then next slide. So as I said before, some general interview structure is panel interviews and MMIs, but we're going to look at how to approach these. But yeah, so some really useful things to approach those types of interview structures and also things you can use for prep is the GMC guidelines. The GMC guidelines is something not everyone does use, but it can be really useful in helping you answer questions. I really did use the GMC guidelines in a lot of my interviews, and I did get a lot of my interview offers relatively fast for the time frame they did have it. So I definitely recommend using them. You don't have to actually learn them all off by heart, but having a few core ones that are actually really true to your values can be so helpful because you can always refer to them because they're something that you really do believe in. Now, using a lot of role play examples, so doing a lot of role plays, because role plays can be something that are really hard to adjust to in the beginning. So definitely try and do a lot of role plays so you can get used to it. I remember my first role play, we actually did one about a cat dying and I started laughing. But I've been asked that question like really like after doing interview prep and being asked that question like maybe 3 weeks later, I wasn't laughing anymore because I'd gotten so used to doing role plays and so used to actually being in the situation that I started taking it a bit more seriously than I was originally. And then having some keywords and phrases you use, for example, using a key GMC pillar, a key medicine pillar, a key GMC guideline, this can be really useful as well. Reading some books, for example, the ISC medical book is one that a lot of people do use for interview prep. Um, yeah, using a lot of weird and wacky examples can also be really good. Practicing with friends and family, I mentioned that at the beginning. Some free guides. A lot of different companies have guides. J2H has a guide. I think Medology also has a guide. Some people also offer interview prep things, but you don't really have to pay for resources. A lot of free resources can get you ahead just the same. And also actually signing up to do MMI practice courses as well. The next slide. So some practice questions. If anyone does want to answer them, you can put your hand up, but if not, I'll just go through the answers straight away. So question one is, would you rather perform 100 hip placements or 100 or one heart transplant? Does anyone want to put in chat how they would approach that question? If not, we can just go to the answers. But I'll give it like a couple of seconds, minutes, a minute. Yeah. Okay, let's move on to answering the question. So some ways you can approach the question and some things you can talk about because all of these questions don't have like a set answer. It's more you can just choose what you want to talk about and format it however you want to approach the question because they're all kind of open-ended. Is you could talk about the risk of rejection even if the surgery was completed. The patient could be on anti-rejection medication for the rest of their life, and this can reduce their quality of life. More people would benefit from hip replacements. You talk about people with hip replacements can go back to work and pay more taxes. If you do psychology, that's like a really key point a lot of the time. You can talk about empathy towards people who need hip placements as they're in chronic pain. You can talk about that staff can be trained while performing hip placements. You can actually acknowledge that this is a difficult decision and you will need to talk about it with the multidisciplinary team. If you ever get a question like this, you should definitely use the multidisciplinary team as part of your answer. You can link it to the ethical pillars for each side. So just talking about some people answer the question by literally working through all the pillars. You could also then come with a conclusion based on your answer. Some people don't come up with conclusions, but if it does ask you for a conclusion, you should give one. The next question. So the next question is, a surgeon has recently been infected with HIV after he cut himself by accident with a scalpel in surgery. You've been assigned to the task of helping decide if he can continue operating. Would you allow him to continue operating? Let's move on to the answers. So some ways that people like to approach this question, because again, this is a really personal question for a lot of people, is weighing up the pros and cons. Actually, remember to look at it from a medical perspective and not really your own perspective. So looking at patient safety, remembering the surgeon is a person and actually finding out how they feel about the mistake they've made, not being judgmental as in the end it was a mistake, finding out what the surgeon plans to do. And you can also go to a multidisciplinary team for help, but in the end, the decision would be up to you. So you actually, this is one of the questions where you would have to answer because it's asked you to state your opinion. But yeah, question number 3. I'm just going to give everyone 30 seconds to read that question. So this question actually does come up quite a lot. It's asking you to compare different people based on different aspects. So you actually have to look at who you're comparing, the different aspects they have, and remember again, you need to stay impartial when making a decision, because even if you were a doctor, again, you don't know what these people have been through and you can't judge them. You're not meant to be judgmental. You're just meant to help them. So actually looking at who needs more help in this situation. So next. So this would be a good medical ethics example because there is no correct answer. But you can use the principle of justice. So this is one of the situations where you can go through the pillars to answer the question, but you can actually approach this from so many different angles. It's mainly focusing on what you believe are the main factors that you need to consider. They want to see how you would logically break down and what you also know about medicine already. For example, I know that in a lot of cases, they actually have a score system which they would use to decide whether or not somebody deserves a liver or not. So you could talk about how that's something you could start with and then work through how actually, but if that situation, if that's not available in this situation, I would then maybe look at the pillars. So actually look at who has more dependents. For example, someone has she's a single mom, so she needs to look after her child. But then look at the fact she has an autoimmune disease. So just breaking the question down. But yeah, next question. So the next question is an example of a role play situation. So this would be in the event that you are a first year medical student walking to town and you notice a friend in your year group who you used to talk to in lectures, sitting on the bench staring at the ground, and you realize you haven't seen them in lectures for a few weeks now, and you go over to talk to them. So this question is kind of really open-ended and just seeing how you'd approach the situation and how you would talk to them. But we're not really going to go through this role play scenario. We're just going to go through how you could approach it. So next. So some general tips for approaching that question would be reading the scenario carefully, knowing who you are in the scenario as well, greeting the actor appropriately. Like this someone who you used to be friends with is number one. And number two, you can see they're not actually very excited or very happy right now. They're really upset. So you need to actually take that into account. Remaining calm and empathetic, showing active listening throughout, asking the active if there's anything you can do to help them. In this role play, they're usually testing your empathy skills, your active listening skills, and actually how you would approach the situation and random things. I know, for example, in St. George's, one of their previous interviews, they actually had an interviewer throw a chair. So you'd actually have to be able to deal with unexpected scenarios like that and see how that approach would happen. But yeah, next slide. I think that might be the last one. Okay, yeah. That's all in terms of interviews then.
Thank you so much, Silver. Yeah, thank you guys so much for attending this week's seminar. I hope you found the topic range better this time. We have been getting a few like feedback forms back, and so we are appreciating all the feedback that you're giving us, and we're trying to change so then it's more suitable for you. But yeah, thank you so much for joining, and yeah, I hope you liked this week's seminar.